Last year, thousands took to the streets in the wake of the murder of George Floyd. Their argument to take money away from police and give it to social services, who are much more qualified to deal with mental illness.
At what point do we pay police to be social workers? No, we don't.
What would it look like if law enforcement did away with responding to nonviolent emergency calls, and rather than an armed officer showing up, a mental health expert responded? Dozens of law enforcement agencies across the country have launched pilot programs to test this new model. And this is what makes this so interesting. They did it without talk of defunding the police. In fact, they didn't take a dime. Let me explain. These programs are based on the premise that 911 calls aren't always equal. Some demand police response, and others require a mental health professional. Orlando Police Captain Lovetta Quinn-Henry oversees the Community Response Team, or CRT. It consists of 5 contracted health experts with backgrounds in mental health and case management. They respond to nonviolent mental health calls unarmed, in CRT uniform, and in this specially marked vehicle instead of a police cruiser.
If the team can go out and the team could actually connect individuals with those mental health providers or community services, maybe they won't get to a point where they're very acute and now dangerous or self-harming.
When did the city decide to move forward with this program?
But in response to the protest last year, City of Orlando, we decided to evaluate every policy and practice that OPD has. As we were looking at our community policing, we're aware that there were some calls that simply didn't need somebody with a badge and a gun. They would be better served as somebody with mental health skills to respond to those calls.
The nearly $500,000 pilot program was paid through general funds and not by defunding the police.
It was new money, new funding, so additional funding.
Since the Orlando Police began its pilot program in March, within the first 6 months, CRT responded to 549 calls. None of them resulted in arrest. However, the CRT recommended 129 people for court-ordered mental health evaluations, and nearly half went on to receive additional care. It's important to note, during the pilot program, some officers continue to respond to some of the mental health calls, but the goal is to diminish their role as the program grows. What are your thoughts on this new collaboration between mental health experts and police? Is it a logical alternative to defunding the police? Let me know in the comments below. Also, be sure to rate this story using our straight arrow bias meter.